Hello, this is Dr. Gay from First Look MRI, and this is a 43-year-old male who has a 2-year history of depression and brain fog. He's been to a few psychiatrists and they've given him medicines, but none of the medicine has really helped him with his depression or cognitive decline. He has an MRI here, but he got this on his own. His father was worried about him and decided to pay for his MRI scan. His psychiatrist said he did not need an MRI, and insurance wouldn't approve it anyway, and so they just wanted to keep changing his medicines, but his father wanted to make absolutely sure there was nothing underlying, and so paid for an MRI scan just out of the medical system. And here it is. So on this view we see his right lateral ventricle looking normal, left lateral ventricle looking normal. There's a little asymmetry, which is just a normal. On this view we really don't see much except for a little bit of asymmetry right here. It's a little bit lower in signal than here. It's very difficult to tell in that view. On this T2 weighted view, fluid is bright. We see the ventricles really light up, and the asymmetry here is not readily apparent. Maybe a little bit of hyperintensity on this side. Only on the flare view, this is the most sensitive view, we really see this abnormality jump out. But on the left side, this is the left caudate nucleus, right caudate nucleus. This is part of the basal ganglia. If we go up one more cut, we see this hyperintensity, so a foggy area of increased signal just on one image in the left caudate nucleus. But the left caudate, or the caudate nucleus, does cause symptoms of memory dysfunction, speech deficits, sometimes cognitive impairments, problems with social function, sleep disturbance, all sorts of things related to behavioral and cognitive and mood problems. So this is probably the source of the patient's symptoms here. And if we look on this view right there, we see this foggy area of hyperintensity on the T2 weighted image in the left caudate nucleus. And this is a coronal view. Let's look at it here. We're going to go forward, forward, and there it is right there. So we have a normal brain except for one small area of abnormal signal in the left basal ganglia, the caudate nucleus, that is probably causing the patient's symptoms. And the question is, well, what is this? So one thing that it could look like this is a glial neoplasm. A low-grade tumor glial neoplasm can cause just an asymmetric area like this without significant mass effect, and definitely is in the differential. Another thing that could look like this is a seizure disorder. If the patient had a seizure focus, you can get a little bit of edema during an active seizure. They could look like this, so the patient will need to get an EEG to see if that's what is going on. Other things are much more rare, like multiple sclerosis can cause a little foggy lesion in the brain anywhere it wants to, but this would be unlikely to be just one lesion in this area, so it's much less likely. An old vascular insult with some gliosis related to it would be extremely unlikely as well. There's something called X-linked adrenal leukodystrophy. There's one case report where a patient had just one-sided caudate nucleus lesion like this, and they had similar symptoms, cognitive decline and behavioral problems, and it turned out to be that, but that's extremely rare, probably unlikely. So again, an indeterminate lesion, but probably the thing causing the symptoms in this 43-year-old patient.